Ginger has been used for centuries for its medicinal properties, particularly for treating joint and muscle pain. This is due to the presence of compounds in ginger known as gingerols and shaogals, which have anti-inflammatory and pain-relieving properties. One of the primary ways that ginger can treat joint and muscle pain is by reducing inflammation. Inflammation is a natural response of the body to injury or disease, but it can also contribute to chronic pain and joint damage. Gingerols and shaogals, the active compounds in ginger, have been shown to inhibit the production of cytokines and other inflammation-causing substances, reducing inflammation and pain in the joints and muscles. Ginger also has analgesic properties, meaning it can directly relieve pain. Research has shown that ginger can reduce pain levels by blocking pain receptors in the body and reducing the sensitivity of nerve endings to pain signals. This makes ginger an effective natural alternative to over-the-counter pain medication for individuals with joint and muscle pain. In addition to its anti-inflammatory and analgesic properties, ginger has also been shown to improve circulation, which can help to reduce joint and muscle pain. Poor circulation can lead to a buildup of waste products in the joints and muscles, which can contribute to pain and inflammation. Ginger can improve circulation by dilating blood vessels, allowing more oxygen and nutrients to reach the affected area and reduce pain and inflammation. Ginger can also help to reduce joint and muscle stiffness, which is another common symptom of joint and muscle pain. Stiffness is often the result of inflammation and a buildup of waste products in the joints and muscles, and ginger can help to reduce stiffness by reducing inflammation and improving circulation. This can help individuals to move more freely and reduce discomfort. There are several ways to use ginger to treat joint and muscle pain. Ginger can be consumed as a supplement, added to foods and drinks, or applied topically as a cream or oil. When consuming ginger as a supplement, it is important to choose a high-quality product that is standardized to contain a specific amount of gingerols and shaogals. Ginger can also be added to foods and drinks as a spice, or it can be made into a tea by steeping slices of fresh ginger in hot water. When applying ginger topically, it is best to use a cream or oil that contains a high concentration of gingerols and shaogals. In conclusion, ginger has been used for centuries for its medicinal properties, particularly for treating joint and muscle pain. The anti-inflammatory, analgesic, and circulation-improving properties of ginger make it an effective natural remedy for individuals with joint and muscle pain. There are several ways to use ginger to treat joint and muscle pain, including consuming it as a supplement, adding it to foods and drinks, or applying it topically as a cream or oil. When using ginger to treat joint and muscle pain, it is important to choose a high-quality product and to consult with a healthcare provider to ensure it is safe and effective for you.